Well, let's go to a familiar face now, infectious disease specialist Dr. Isaac Bogoch. He joins us in Toronto. Isaac, nice to see you again.
Hey, good to see you as well.
So listen, it's been interesting. We keep getting questions from our viewers to ask of the medical experts that join us today. And first and foremost, I want to begin with this quarantine, because we're being asked this online about basically having to self-quarantine for 14 days after you arrive back here in Canada. How do you know you're okay after those 14 days? If people can be asymptomatic, how do you know that the 14 days is enough?
I think the key thing here is, if someone's going to have the infection, it's going to happen within that 14-day period of time. Most people that have this infection, clearly, as you point out, have very mild course of illness, and sadly, we know that many people will have more severe infections. But by and large, people will have some symptoms, and if you develop symptoms, if you develop a fever or a cough or shortness of breath, doesn't matter how mild it is, you should not be going out, especially after those 14 days. And if you develop any symptoms that are suggestive of a COVID-19 infection, that's when you dial your local public health number and say, listen, I've got these symptoms. I'm in my 14-day home isolation period. What do I do? And they'll point you into the right. They can talk you through it and discuss if this is compatible with an infection. And if not, they can also point you in the direction of how you can actually get tested and how to move forward from there. So I think the key thing is, if there's any symptoms at all, it's time to call and walk through this with a professional to make sure that you go down the right path.
Mm-hmm. Okay, let's bring in a question now, and this is being sent to me on my Twitter account. This is from Linda McDonald. She has this question: has the health directions changed about everyone wearing masks when out in public? And clarify this for me, because people do want to wear masks right now, although they keep being told if you're not sick, you don't have to wear a mask. Are masks such a bad idea?
So there's a few things there. I mean, this question's come up since January, and I appreciate that everyone's entitled to an opinion, and that people will have vastly different opinions on the matter. Please feel free to disagree with me. I get a lot of angry emails after this, but here's the party line, at least as far as I'm concerned. When you're wearing a mask, we have to remember that a lot of times these masks don't protect people from getting the infection. They prevent people from spreading the infection if they're infected. And here's why. Number one, people are wearing the wrong masks. Number two, if you're wearing the right mask, you're not wearing it properly. Number three, if you're wearing it properly, you might not be fit correctly for the mask. So there's different fits of these masks. And number four, they're not, I mentioned already they're not reusable. But number four is, lots of people touch the mask and readjust the mask and touch their face all the time when they're wearing the mask, which completely negates the whole benefit of wearing the mask. So this is, for the most part, why masks don't really work. And they're good in certain environments, like in healthcare environments, where we are literally coming face to face with someone with this infection and are right within the cough zone and the sneeze zone. It's like going to SeaWorld, you're in the splash zone. You really are in healthcare settings, and it's extremely important to wear a mask in those settings. But just walking around in public, I personally don't think that's a valuable asset to have.
But what about grocery stores, though? I know people are supposed to be physically distancing, but you walk down an aisle of a grocery store, people are getting close. Wouldn't a mask help in that instance?
I just think we can do better to keep apart, and we also have cough and sneeze hygiene, right? People should be very mindful about coughing and sneezing into their arm. People should be mindful about keeping 6 feet apart or 2 meters apart. If you think about, it's a great example. Let's look at a grocery store. You look down the aisle. Look, if the aisle is packed with people, maybe wait and go down another aisle and then come back. Or if you're walking down the aisle and there's 2 different people, spread out down the aisle. You don't have to, shake hands as you're walking by each other. So I think there's still room for spreading out, for hand hygiene, for cough etiquette. And again, people will do what they do, and that's completely acceptable. But if you're asking from the medical and public health opinion, from the medical and public health side, we're saying that these masks aren't helpful for the reasons I listed off just a bit earlier.
Okay. Listen, I want your opinion on this, because this isn't so much a question, but this is a statement that I'm getting on Twitter. Someone on Twitter who goes by the name of Mama Tweet, she is asking doctors like you to give the advice out there to close these buy and sell groups on social media like Facebook, because they've not actually stopped, apparently in some cases. What do you think of the fact that people, as they stay at home, are now still participating in these buy and sell groups on social media?
I have to admit, I like to think of myself as tech savvy, but I don't know what those are.
Okay, fair enough. That's when people sell, for example, baby clothes that their children are no longer the size of, and then they exchange in their communities, these buy and sell groups.
Got it. Well, okay. So maybe let me opine on that. But obviously, we know what to do, right? We know to stay apart. We know how to physically distance ourselves. We know how to stay out of high contact areas. I mean, if there's a creative way where you can continue doing this, where you don't physically come into contact with other people, maybe that's okay. But I have to say, I'm not entirely familiar with those groups. But if there's a way to carry on doing this in a safe manner, with good hand hygiene, with ensuring that whatever's being transferred back and forth between people is clean or has the possibility of being wiped down, and we're still avoiding crowds and not clustering together. And if that can be done and we can really adhere to the public health measures, that sounds reasonable. If you can't, okay, then it's clearly time to stop.
Okay. Another question here. This is from IST on Twitter, IST, who sent me this tweet. What does recovered mean? Can you get COVID-19 again?
Oh, IST. That's a good question. So the short answer is we don't entirely have all the data to answer that, but the more nuanced answer is that, it's widely believed in the medical and scientific community that if you have this infection and then recover from this infection, you are not going to get this infection again, at least for the course of this current pandemic. So you're likely immune to this infection. You will be okay, at least for the course of this pandemic. Now, we know that viruses can change. It's called mutations. They change over time. Maybe if this virus is still hanging around in low levels in a year from now, maybe it changes enough that you could be reinfected with it. But the current understanding is that once you're infected and recovered, you're okay.
Okay, another, this is on Twitter from Ian Forsyth, who wants to know this. In what ways could those who have recovered from COVID-19 help with potential treatments and vaccines in the future?
So very interesting. So, soon we're going to have blood tests available. They're already being developed. They're starting to be deployed. These are called serology tests, and they really answer the question, have you had this infection, yes or no? It doesn't answer the question, are you infected? It's, have you had this infection, yes or no? And that will be a way to identify people who have recovered from this infection. And certainly, it can be very helpful to know who those people are. One, because it can give us a better understanding for surveillance measures of how many people have actually had this infection. Two, it can help focus. Imagine if you identify, for example, frontline healthcare providers that have already had this infection who are now immune and not going to be reinfected. You can have those people care for people infected with COVID-19 and be safe because they're not going to be reinfected with this virus. So you can identify people in that regard. And the third thing is there's now some treatments that are still experimental where you can use what's called the plasma. It's the liquid part of the blood that has proteins in it to treat people who are infected with this virus. And they use the plasma of people who have recovered from this virus to help treat people who are infected with this virus. There's still a lot of research that needs to be done on that front. These are still unanswered questions, but this has been done for decades for other infections. For example, they've tried this with Ebola in the 70s and in the 90s, and mild success, I would say. So that's being looked at right now for COVID-19.
Okay. Now, and this is my question to you, because, we've been hearing about a vaccine being about a year away against COVID-19. But you used the word treatment. Will there be a Tamiflu version for COVID-19 that might be applied or be found before a vaccine?
Yeah, absolutely. And in fact, there are multiple clinical trials across the globe. And of course, here in Canada, from coast to coast, we're now recruiting patients into these trials. And it's really exciting. It's not just treatment trials, clearly looking for, new drugs that can treat this infection. So shorten the duration of infection and really help improve clinical outcomes. But there's also prophylaxis trials, meaning if someone was exposed to this virus, can we give you a drug that will help prevent you from getting the infection in the first place, which would be extremely helpful in situations like healthcare settings or nursing homes or long-term care settings. So these trials are open, they're active, they're recruiting patients, they're here in Canada, and many hospitals are participating in these right now. So hopefully we do have a known treatment. But of course, the long-term game plan is vaccination. That's really the holy grail here.
Okay. We heard from Dr. Teresa Tam, and this will be my last question to you because I do want to get your thought on this. She gave her, once again, daily update today out of Ottawa, and she was talking about how the next couple of weeks will be critical in understanding how this country has either successfully or perhaps not successfully dealt with COVID-19. Talk to us about these next couple of weeks and why someone like you, who's been studying this disease, is interested in seeing the trajectory.
Yeah, I mean, she's spot on as always. It's Dr. Tam. She's incredible. But really, these next 2 weeks are crucial. Wow. I mean, we really need to adhere to these physical distancing measures because the next 2 weeks, we're going to still see more and more cases of this infection from coast to coast. And it's extremely important that we just, as we've all heard the term, flatten the curve. We'll know in the next 2 weeks if what we're doing is working, because sadly we're seeing a greater number of hospitalizations with this infection, a greater number of admissions to intensive care units. Sadly, we're seeing a greater number of deaths. This will continue to climb, but how much this climbs is completely dependent on us. And we obviously have to do everything possible to avoid a scenario like we're seeing in Italy and in New York City and elsewhere in the world. We can do this. It's really up to us. And it only works if we all buy in. So the next 2 weeks will really be telling if we take a more smooth path or unfortunately a rougher path. And man, me and of course everyone else hopes that we take the smoother path here. Because it could get ugly if we really don't adhere to these guidelines. We don't have to look too far. It's just happening in New York City right there. We can see what happens if we don't buy into these measures.
Yeah, no, absolutely. Just across the border, we're seeing tens of thousands of people being infected, many of them dying. So I guess it's all about adherence for the next couple of weeks then.
And of course, even if we do start to flatten our curve, we still have to buckle up because it's going to be a long ride. We have to adhere to this for months, at least 2 months. See, it's not just a matter of flattening the curve and saying, okay, job's done, we can walk away now. Then it's time to really get ready to run a marathon. This is not a sprint. We're going to be doing this for certainly for the foreseeable future. And I don't think public health will let up on these on this huge push, on this huge public health push until we see a sustained reduction in the number of new cases per day. And then and only then will they think about lifting some of these measures. And that's at least 2 months away.